Right now, most of our connections are via electronic device. And the electronic devices, in order to be connected to your device, you want to isolate yourself from other people, so we use earbuds. The amount of time we're doing it has changed so much. So if you're using these things 8 to 10 hours a day, that's 2-3 times what people are accustomed. But we know that young people who are exposed to a lot of noise or sound will have these noise-induced hearing losses. The duration of the exposure and the intensity of the exposure is important, but what's more important is the behavior of the individual. If a person is in isolation in a quiet room, that person is only about 20% likely to expose themselves to too much sound. Put the same individual on a train or in a plane, and they're like 80% likely to exceed that level. If we keep going at the rate we're going to have a population that has significantly greater hearing loss. So for example, right now, it's common for young people to have hearing loss right now, as it is, and in the way it manifests itself, it's similar to what you find in 70-year-olds.
Since I've started, I've usually only used to listen halfway, and now I need to get my music louder and louder to achieve the same effect that I had it before.
I think I've noticed over time a bit of the need for me turning up the volume has gone up a bit more.
Every time you're hearing what I'm saying right now, it's traveling through the ear, and it has to actually go through this amazing series of changes. The cochlea is actually powered. It's a powered amplifier, and that is where the damage occurs. In order to hear my voice, your cochlea is actually fine-tuning and amplifying everything, and in the process creating sounds that you can't hear.
I use my earbuds about 3 to 4 hours a day, just depending on where I'm going and what I'm doing that day. I use them mainly for when I'm working out or when I'm studying.
So anytime I'm walking to class or walking anywhere, I usually have earbuds in, and anytime I'm at the gym. And I spend about an hour and a half at the gym, so it's right there, it's an hour and a half. So I say 2 to 4 hours.
I use my earbuds at work, also working out. And I work Monday through Friday, 8 to 9 hours.
So we know there's a link between hearing loss and cognitive decline. Even neurological imaging shows us that there is a drop in the cortical volume in these areas that are very important for memory, for processing, for language. And they're linked to early stages of Alzheimer's, of dementia. The link is with other things, with depression, with diabetes, with heart disease. There is many systemic problems that are linked to hearing loss. That alone is worthy of some research. The amount of volume is directly related to the time and if it equals damage or not. My recommendation is that why risk it? Find a way to lower the volumes by isolating yourself. Get better headphones, get noise suppression. And to be aware that it is the direct relationship, not just with the volume, but the duration of usage. Take an inventory of how many hours a day you're using them, and then do some research.